again, my name's Haley, and I'm going to be doing a physical exam on you today.
Okay, Haley, thank you.
Can you state your name and date of birth for me?
Shannon Hooker, 43076.
Okay. And can you tell me where you're at right now?
I'm at Advanced Cardiovascular Specialist,
Okay. Can you tell me the year?
2020.
Can you tell me the current president?
Trump.
That is a hard question
Yeah.
right now, but as of right now, who is the
Trump.
president? Okay, thanks. I'm just going to wash my hands before we get started, okay?
Good.
Alright, first we're just going to kind of take a look at your head. Are you having any problems like headaches, dizziness, anything like that?
No, ma'am.
Okay. Alright, are you having any pain or tenderness anywhere in your head?
No.
Okay. Any trouble with hair loss, hair falling out, anything like that?
No, ma'am.
Okay, awesome. Alright, are you having any trouble with your jaw, as far as chewing or anything like that?
Nope.
Okay, I am just going to ask you to open your mouth. I'm going to feel your jaw move here. Close it for me. Can you clench? Perfect. Did that cause any discomfort?
No.
Okay, awesome. Okay, now I'm going to check for facial sensation. So what I'm going to do is I'm just going to grab a little piece of cotton and I'm going to ask you to close your eyes. I'm going to touch different places on your face and I just want you to tell me where I'm touching you at.
Okay.
Alright, go ahead and close your eyes. If it's okay, can you just take one side of your mask off for me or pull it down? Okay, and just tell me where I'm touching you. Okay. Perfect. Okay, you can put your mask back on.
Thank you.
Alright, so now I'm just going to look at some of your facial movements. Can I get you to take your mask off again?
Yes.
Alright, can you close your eyes for me? Open them. Can you squint your eyes? Okay, awesome. Can you smile for me? Okay, open your mouth. Close your mouth. Perfect. Alright, next we're going to move on to your eyes. Are you having any visual disturbances or anything like that?
Nope.
Okay, we would check visual acuity with the Snelling eye chart, but we don't have that here, so we're just going to pretend like we've done that. Okay, so we're going to move on to your eyes. Any eye pain or anything like
No.
that?
Do you need me to take my
Yeah,
glasses
if you
off?
could just remove your glasses. All right, close your eyes. Does that cause any pain?
No.
That?
No.
Okay. No tenderness?
Mm-mm.
All right, can you open your eyes for me? Have you had any drainage, any redness that you've noticed, anything like that?
No, ma'am.
Okay, perfect. All right, now I'm just gonna ask you to follow my finger with just your eyes only. Okay,
Okay.
don't move your head. Perfect. All right, you can put your glasses back on.
Thank you.
All right, I take that back. I'm actually gonna look at them real quick.
Okay.
See if we need this to work. Okay, just keep your eyes on my nose, okay?
Okay.
Get a little closer, sorry. Okay. Same thing. Okay. Just keep looking at me. Perfect. Perfect. Okay, any trouble with your ears that you've noticed? Any ear pain? Trouble with hearing? Anything
No.
like that? Okay. I'm just gonna take a quick look in your ears. Alright, good pearly and gray. Same thing for this side.
Yay.
Alright, now I'm gonna ask you, you put your glasses back on, we're done with the eye part.
Thank you.
I'm just gonna ask you to close one ear with your finger, just kind of press it down. And what I'm gonna do is I'm gonna whisper sequence of letters and numbers on this side, and I just want you to repeat it to me whenever I'm done, okay?
Okay.
8 and 3. Can you repeat that to me?
8 and 3.
Perfect. Now change ears. H7L.
H7L.
Okay, perfect. And if we had a tuning fork, we would do the Rhymes and the Weber's test. All right, so now we're going to check your sense of smell. Have you had any loss of smell that you noticed or anything like that?
No, ma'am.
Okay, what I'm going to get you to do is I'm going to get you to close your eyes and close one nostril. I'm
Okay.
going to place something that has a smell underneath that nostril, and I just want you to try to identify what that smell is, okay?
Okay.
All right, you just want to take a little sniff.
Alcohol.
Perfect. All right, you want to change sides? And can you tell me what this is?
Coffee.
Yes. Perfect.
It smells good.
It is morning time. Okay, now I'm just going to inspect your nose cavity here. All right, looks good. Any trouble with your gums or teeth,
No, ma'am.
tongue, anything like that?
No,
Okay,
ma'am.
I'm going to just get you to stick your tongue out for me real quick. Just going to take a quick look.
Sorry.
Perfect. And we would test the gag reflex, but I'm not going to perform that today. All right, moving on to your neck. Have you noticed any abnormalities there? Any swelling, swollen glands, anything like that?
No, ma'am.
Okay, I'm just going to palpate here a little bit and feel your trachea. Alright, it is midline. I'm going to stand behind you here and just kind of press. Any pain with that?
No, ma'am.
Okay, perfect. Alright, any pain or tenderness anywhere in your head, like where lymph nodes may be?
No.
Alright, perfect. Alright, any trouble with breathing, shortness of breath, trouble getting a good deep breath, anything like that?
Mm-mm.
Okay, perfect. Alright, take a look at your fingers here. Have you noticed any bluish discoloration or anything
No.
like that? Perfect. Alright, so I'm just gonna ask you to take a bunch of deep breaths in and out, and I'm gonna take a quick listen to your lungs, okay?
Okay.
Just keep taking breaths in and out until I tell you to stop. And you hold your arms out a little bit. Perfect. Deep breath. Have you noticed any heart palpitations? Ever feel like your heart's racing or anything like that?
No, ma'am.
Okay, I'm just gonna palpate here for just a second. Okay, awesome. And if we were looking for JVD, we would put the head of the bed 30 degrees to measure that. Alright, now I'm just gonna press on your chest wall, tell me if there's any tenderness or anything.
Okay. Good. 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 Good.
Okay, awesome, I'm gonna take a quick listen to your heart, okay?
Okay.
Okay, perfect. Alright, so now I'm just gonna take a quick listen to your neck. I'm gonna listen to your carotid arteries, okay?
Okay.
Okay, perfect. We would also auscultate the renal, iliac, and femoral arteries, but we're just gonna say that for today's purposes. And just gonna have you lie back a little bit. I'm gonna take a listen to your aorta.
Okay.
Okay, perfect. You can just stay like that if you're comfortable.
Very comfortable.
Okay. Alright, so now I'm just gonna kind of check for your pulses throughout your body and make sure you're getting good perfusion. Alright, can I check this pulse? Awesome. Alright, can you uncross your feet for me?
Yes, ma'am.
Okay, have you noticed any coldness in your toes or anything like that?
No, ma'am.
Okay. Alright, have you noticed any tender or swollen lymph nodes under your arms or anywhere like that?
No.
Okay. What about in your groin area?
No.
Okay. Alright. Alright, so now we're gonna move on to your abdomen. Have you had any stomach pain or anything like that?
No, ma'am.
Okay. Just gonna take a listen to your tummy first. Good bowel sounds.
Yeah, probably.
Alright. Now I'm just gonna palpate. You tell me if this is tender in any way, okay?
Okay. No. Mm-mm. Mm-mm. Not at all.
Alright. perform, percussion. Have you had any trouble with memory loss or anything like that?
No, ma'am.
Okay, perfect. Alright, so I'm just gonna take a look at your upper and lower extremities. Have you noticed any weakness or loss of muscle, anything like that?
No.
Okay. Alright. Calf muscle. Alright, perfect. Alright, and we would check for deep tendon reflexes. Alright, so now I'm gonna get you to sit up for me. Have you had any balance disturbances or anything like that? Okay, I'm gonna get you to stand up for me. And I want you to close your eyes, hold your hands out, and then put finger to your nose, one at a time. Okay, perfect. And have a seat. Alright, and then we would check for light touch on the toes, which we're not gonna make her take her shoes off, and make sure she was able to assess different temperatures. Alright, any trouble with your neck or your spine, anything like that, giving you trouble?
Mm-mm.
Okay, shoulders are equal. Alright. Okay, perfect. Alright, can I get you to raise your shoulders to your ears and down? Awesome. Alright, can you lift this arm up forward? Can you go up above your head and back down? Same thing with the other one. And down. And can you bring your arm back? Perfect. Other arm? Alright, awesome. And can you open your arms? Hit the wall there. Okay, good job. Alright. Any trouble with your hands or fingers?
No.
Alright, can you turn your wrist upside down? Move all your fingers. Any pain with that?
No.
Open and close fist. Perfect. Alright, any trouble with your hips or anything like that?
Nope.
Alright, I'm gonna get you to lie back one last time for me.
Oh, you know.
We're gonna go back a little bit further.
Okay.
Okay, perfect. Can I get you to just raise one leg at a time? Perfect, just like that. And can you bring the knee up a little bit more? Perfect. Down. Other one. Perfect. Down. Alright, you can sit up for me. Alright. And can you lift your feet up, point your toes up, point them down? Okay, can you rotate your ankle kind of in a circular motion? Perfect, and this completes our physical assessment.